Every year, on the 1st of December, the world shines red. Banners change, buildings glow, leaders deliver polished speeches. News anchors read familiar lines. And yet, here's a truth many of us don't really say out loud. When World AIDS Day appears, most people keep scrolling. We recognize the red ribbon, but we don't pause. We see the posts, but we don't look deeper. Maybe we think it's a story from the past. Maybe we assume we already understand. Or maybe it just feels heavy, uncomfortable, and easier to avoid. But just for a moment, before your mind moves on, stay with me. Because behind this one symbol, behind this single red ribbon, lies one of the most mysterious, misunderstood, and deeply human stories of our time. A story woven with fear, silence, activism, science, heartbreak, and extraordinary hope. A story that shaped families, changed countries, and pushed medicine forward in ways the world had never seen. And here's the part that truly matters. If we don't understand how it began, how it spread, how we fought it, and what we learned, then the world risks repeating mistakes that once cost millions of lives. World AIDS Day isn't simply a symbolic moment. It's a reminder, almost like a quiet tap on the shoulder, telling us where we've been and where we must go next.
Part 1. The origin story. The beginning wasn't loud. It wasn't dramatic. It was quiet, almost invisible. In the early 1980s, doctors in Los Angeles and New York started seeing strange cases. Young men who are healthy suddenly collapsing with rare infections, pneumonia that shouldn't appear in people that age, cancers almost no one had heard of. Their immune systems were failing, but no one knew why. At first, people whispered. Then they panicked. Headlines used harsh words: gay plague, mysterious cancer, death sentence. Fear spread faster than facts. Hospitals wore double gloves. People refused to touch or even sit near patients. The truth emerged slowly. A virus, HIV, the human immunodeficiency virus, was destroying immune systems, and, when left untreated, it led to AIDS. But the deeper origin traces back even further. Scientists later found evidence of HIV crossing from chimpanzees to humans in the early 1900s in Central Africa. It quietly spread for decades before the world even knew it existed. It wasn't just a medical crisis, it was a cultural one. Millions were affected: men, women, children, families. Yet many suffered in silence because society wasn't ready to have the conversation. This is why we remember, because silence was deadly. Part 2. The red ribbon symbolism. In the early 1990s, as stigma raged and discrimination pushed people into the shadows, a group of artists decided to fight back, not with medicine, not with politics, but with a simple symbol. They designed the red ribbon, not to represent danger, not to represent shame, but to represent love, compassion, and unity. The ribbon was designed to be simple, wordless, something anyone could wear without having to explain themselves. Its first major appearance was at the 1991 Tony Awards, where celebrities quietly pinned it to their clothing. No speech, no announcement, yet the message spread instantly. Soon, millions around the world adopted it. For some, it was a gentle sign of support. For others, it was a brave statement. I stand with people living with HIV. The red ribbon didn't end the epidemic, but it broke the silence. It turned HIV from a hidden struggle into a human story, one that demanded understanding, empathy, and action.
Part 3. The evolution of treatment. Now this part is where everything changes. In the beginning, there was no treatment at all. A diagnosis meant preparing for the worst. But science refused to give up. 1987, the first drug, AZT, arrived. It helped a little, but came with severe side effects and didn't work for everyone. Mid-1990s, a revolution, combination therapy, later known as ART or antiretroviral therapy. Doctors discovered that using multiple drugs together could stop the virus from multiplying. Suddenly, people who were told they had months to live saw their health return. Hospital wards emptied, life expectancies soared. HIV was no longer a death sentence. 2000s to today, treatment became simpler, safer, and far more powerful. Instead of handfuls of pills, many people today take just one pill a day. And when taken properly, it lowers the amount of virus in the blood to undetectable levels. And here's the life-changing part. Undetectable is untransmittable. When someone's viral load is undetectable, they cannot pass HIV to others, not through sex, childbirth, or everyday contact. This fact alone shattered decades of fear and stigma. It allowed couples to build families. It gave people their futures back. And today, scientists are even exploring vaccines and functional cures. The fight continues, but hope has never been stronger.
Part 4. The social fight and stigma. But medicine isn't the only battle. Even today, millions hesitate to get tested because they're afraid, not of the virus, but of judgment. Some believe HIV can spread through touch, tears, or sharing food, even though it cannot. Some think HIV affects only certain groups, even though it affects everyone. Stigma pushes people away from clinics, away from information, away from help. History shows what stigma can do. People lost jobs. Children were bullied. Families were torn apart. Patients were isolated in hospitals. Some were refused care entirely. Activists had to fight, loudly and painfully, for dignity, for attention, for funding, and for basic humanity. Many risked everything just to say, "We matter. We deserve to live." The social fight is as important as the medical fight, because stigma kills by stopping people from seeking treatment and support. And this is why awareness days like World AIDS Day matter. They break silence. They remind us to replace fear with facts, judgment with understanding. Part 5. The future goals. So where do we stand now? We stand in a world where treatment truly works, where one pill a day can let someone with HIV live a long, healthy life. Prevention tools like PrEP are protecting millions. Mother-to-child transmission has dropped to the lowest levels in human history. And every year, science moves closer to something once thought impossible, a functional cure. But we also stand in a world where the challenges are still real. Millions still don't know their HIV status, often because fear keeps them away from testing. In many countries, life-saving medicine is still too expensive or too limited. Stigma continues to silence people, pushing them into the shadows instead of toward care. And in some communities, basic HIV education is still missing, allowing myths and misinformation to spread. That's why the goals for the future are so important and so urgent. End new HIV transmissions through treatment, prevention, education, and testing. End stigma, so no one is afraid to ask for help or share their story.
Ensure equal access to treatment worldwide, not just for those in wealthy countries, but for everyone. Continue investing in research for better prevention, vaccines, and ultimately, a cure. And build a world where every person, no matter where they live, can know their status without fear. These goals aren't out of reach. We have the tools, the science, and the knowledge. What we need now is commitment from governments, from communities, and from each of us, choosing compassion and understanding over silence and stigma. Because the future of the HIV story isn't written yet, and what happens next depends on all of us.
In summary,
World AIDS Day is more than a symbol. It's a reminder of a story that changed the world, a mysterious beginning, a devastating spread, a movement built on courage, a ribbon that started a conversation, treatments that turned despair into hope, a social fight that continues today, and a future that could bring the first generation free from AIDS. So if you've ever scrolled past the red ribbon, today, don't. Take a moment to learn, to reflect, to support, and to understand. Because when we remember the past, we protect the present, and we build a future where no one has to live in fear of HIV ever again.